pathways and things.
Posie, I'm also, having only just arrived, I've also got to shoot off quite quickly as well because I've got things in the diary.
Okay. Well, you can speak quite early then if you want.
I'm fine. I'm not saying that.
I just got microphones on, by the way. Okay. Where's my microphone? Iris? Where's the microphone? No? Thank you. Right, and which one's, sorry Laura, which is in and which is out? Because I need to make sure this is working.
One is line in.
Line in? Yeah. Okay, so this needs to be out. So she's put this one in as well. Okay. That's all right. That's all right. Hello. Hello. Oh, switch it on, yeah. No. Leave that one as it is. I don't think it's switched on. Hello. Can you just see if it's, you just listen. Hello?
Yeah.
Sorry. Good afternoon to the captured Nursing and Midwifery Council. Shame on all of you. We are Let Women Speak, and we are here to talk about the absolute tragic state of the NHS under the guidance of the Nursing and Midwifery Council, who happily endorsed the medication that sterilised children. Happily endorse the rollout of healthcare, supposed healthcare, that sterilises children, eradicates their fertility, and also slices the breast off of young, vulnerable women. So, good on you all, aren't you great? So in this building today, the reason we're here is there's a council meeting of the Nursing and Midwifery Council. And we'll just remind you that they didn't support their colleagues who have had to take the NHS to court because they didn't want to get undressed in front of a man who basically kept asking them, please get undressed in front of me. I beg of you, it will really help me get excited. I mean, I don't know if he said all those words in exactly that order, but he might as well have. So the Nursing and Midwifery Council, they are also promoting within the NHS men taking lots and lots of drugs so that men can put their nipples into babies' mouths and get them sucked. I think that's what you do, isn't it, lads? Hello? So anyway, behind me is the Nursing and Midwifery Council. You might call them a council, we just call them a group of cowards who have really stood for... Oh, do go fuck yourself. Yeah. What? This young lady likes sterilising children, is that right? Did you want to say about sterilising children?
This is honestly vile. This is honestly vile. What you're doing.
What? You want to sterilise kids?
Attacking the most
No,
marginalised
they're not marginalised, they're AGPs.
Yes, you are.
They're not
Yes, you are.
marginalised.
Those are my
They're
friends.
not, well,
That's my
you need better
community.
friends, because you seem like a bit silly. You seem a bit silly.
What you're doing.
God, no. Go on, okay, no. Hang on, this is Let Women Speak. Oh, come on, you tell... This young...
Shut down. You
Excuse
want to
me.
let women speak.
Okay, right, get this silly manic expression off and I will hold the microphone. Yes, that one, where you look overexcited. Yes, I am being rude about your face. So, your expression, not your face. If you want to speak, I will hold this and you can tell all the people passing by why you think it's okay to sterilise children and cut the breasts off of vulnerable young women. Is that what you want to do?
Representing the facts.
Okay, so here's the facts. Go on, then you tell these people why you think it's okay to sterilise children.
Can I ask you a sincere
Yeah, go on.
question? What brought you to this kind of thinking? What took you?
Women in the NHS being forced to get undressed in front of men. That's what brought me here. Are you okay with that?
That's not.
Are you okay with that?
What's happening?
So there's some
Trans
nurses.
women aren't men.
Okay, hang on. So
I'm
what
sincerely
is?
concerned about how you.
Explain to you.
Yeah.
I'm going to explain to you
Really close.
exactly what happened to me personally. I was in a
private hospital in an assessment suite, preparing for a life-saving operation, and it involved 2 weeks I would be in bed for 2 weeks afterwards. And what happened was, a man with a gender identity, female gender identity, didn't knock. He walked into my clinical assessment suite where various things were being done, clothes on, clothes off, measurements being taken in readiness for my operation. And when he walked in on me, and he shouldn't have done that, he had no business being in the suite.
A doctor?
It was a nurse in a woman's, with a wig, full makeup,
So
evening
a trans
makeup.
woman who was a nurse?
Well, you described that person as a trans woman.
And how did that
I
harm
don't.
you?
I'm sorry.
But how did that harm
Right,
you?
She was
I
having an
haven't-
exam.
I haven't finished yet. It was a breach of my privacy. It was a patient dignity breach under the CQC fundamental standards. It was a patient dignity breach. Anyway, I would have let it go. Can I just finish? I'll tell you what happened. I'll tell you what happened next. I then made a request for same-sex care. And what I wanted were women to look after me when I was bedridden after my operation. And I think that's a reasonable request.
Okay, can I speak now? So I've been through healthcare processes. I've watched family and loved ones go through healthcare processes, and I think what's important is that we're served by healthcare professionals. If that healthcare professional is wearing a wig, is wearing makeup, is however they want to present to come to work, what's important is that we're looked after with the care and dignity we require.
What if that's
And
not
that-
dignity?
and the
What if you
sex-
don't feel
the sex
dignified?
or the gender of the person really shouldn't matter. That's
The
ultimately
patients
in
don't
2025,
matter. So
we're-
the patients don't matter.
Yes, the patients
So
don't matter.
what
Did I say
is the
patients
crime?
don't matter?
Yeah, you
Did I
did.
say-
You said
no, I
patient.
didn't.
Yes, you did.
I mean, you are a little bit ludicrous.
You said
Because
that
you
patients don't.
That's
So,
not what I
okay,
said.
this is a patient. She wanted
I've also
same-sex
been a
care.
patient. My mum has
Does
also
she
been a
have the right to
patient.
same-sex care? Does she have the right to same-sex care?
But what I'm
Does she
saying-
have the right to
You're
same-sex
shouting
care?
at me and then you're taking the microphone away.
I'm asking you a question. Does she have the right
So
to
let me
same-sex
speak into the
care?
microphone then.
Are you going to answer the question?
I'm going to answer the question if you put the microphone in my
Okay,
face and
yeah.
don't grab it away again. She has the right to care with a qualified medical professional.
So that's
And
a
I
no.
don't think it should matter.
That's a no.
Gender is a social
Does
construct.
she have the right to same-sex care?
Why
Does
that
a woman
matter?
have the right
Why
to
does that
same-sex
matter?
care?
Why does that matter to you so much?
Because
You want to
women want
repress-
same-sex care. Does a woman who's asking for a same-sex care from a doctor, does she have the right?
I just think what you're doing
So that's a no.
is attacking
So
a
you
very
say
small
no.
minority group of people.
They're not a
over
small
something that
minority.
didn't-
They're not a
doesn't
minority.
actually cause harm. They
Right,
are
this
a
young lady
minority.
doesn't think that a patient should be able, a woman.
I think a patient
should
should
be
have
able to
adequate
ca-
healthcare from qualified
And if she,
professionals. And whether
okay,
they're wearing
what
a
if
wig
she's
or
a,
not,
what if she's a Muslim? What if she's a Muslim woman wearing a hijab and she doesn't want men to touch her? Does she have the right to same-sex care? Do you care about women? Do you care about Muslim
I just
women?
think your rhetoric is so harmful.
Does she have the right to same-sex care? So that's a no.
It's really sad to me because some of my friends.
It's really sad to me that women can't have the right to same-sex care. It's like really sad. It's really sad. You're very dangerous. Your thoughts are very dangerous. You're basically saying that a woman doesn't have the right not to be sexually assaulted in the NHS.
If you're wearing a
Okay.
wig, what if you're. Okay, can I tell you a story about my experience in healthcare and my mum, who died of breast cancer?
I'll finish mine first.
Well, how do you know it was your mum?
Oh, you insulted my mum who died of breast cancer.
I'm just saying, how do you know it was your mum?
This is horrific.
I just want to
She's
explain.
laughing at me for my mum dying of breast cancer.
No, she's not.
No, I'm not. No, I'm not. You're twisting my words. You're
Under
twisting my words. So
under
when
this-
my mum
under that- no,
had
let
breast
me-
cancer.
I haven't finished what
Okay,
happened
you-
to me, okay?
yeah,
Because
sure.
it is very
No,
serious.
please finish.
Okay.
Please, and I respect you and I respect your
Okay.
story.
So
I'm not
Just
sure
not
about
her
this.
I would like
Just
to
not her
point
integrity.
out to you that under the CQC fundamental standards of care, a woman is entitled to ask for same-sex care. They are entitled to that. But when I made my request, and it was a properly phrased request for same-sex intimate care, and I'm talking about things like being in bed, you know, being bathed and so on, personal care, which is perfectly reasonable and it affects a lot of disabled women and so on. When I made that, actually it was a demand for same-sex intimate care, the operation was cancelled for ideological reasons along the lines that you're talking about, okay? And then when there was publicity, and they were in the wrong because it was unlawful what that hospital did, okay? It's unlawful because women are entitled under the CQC fundamental standards of care. No, because that's not same-sex care, and the Supreme Court has ruled on this.
I'm so sorry,
No,
guys, I actually have a
you're
healthcare
at
appointment,
odds.
so I'm
You're
not
at
going to be able to
odds.
stay any longer.
Is it
You're
brain
at odds
related?
with the Supreme
Sorry.
Court.
Is it brain related?
And
You're
you're
really mean,
Is it
really
brain
rude.
related?
I think you need to look
You
inside
think men
yourself.
can be women and you don't care about women?
I think you need
Bye-bye.
to look inside yourself. 'Cause
I've-
you're quite
well,
a
I'll
nasty
find
person,
over
but I
it.
do
They
hope
know,
you know
listen,
the race. I do hope
and the
you know
hospital,
I'm so sorry,
the
I have to
hospital
leave, 'cause I actually have a
reinstated
healthcare
and
appointment.
changed their policy because their policy was unlawful. And you're imposing a breach of the law on disabled and vulnerable women. That's what you're trying to do.
I'm not.
Yes,
Some of my
you
best
are.
friends are disabled and
Yes,
vulnerable.
you are.
You know what you could be
And
campaigning
they're
on right now?
non-verbal.
So if
A
you
lot of these women are non-verbal. That's
guys,
why we're here.
guys, if
We're
you
not
care
here
about
for
disabled
middle-class women.
if you care about disabled women, you should be protesting.
We're here for disabled and vulnerable women who can't speak for themselves.
Get down to Parliament.
This young woman thinks that women are not entitled to same-sex care, even vulnerable women, disabled women and very unwell women. Oh dear. Well, what she won't acknowledge is she also thinks that women can have penises. So, actually we've got a test for that. If any men are looking for a smear test, the Nursing and Midwifery Council will give you one. And if anyone are looking for a prostate exam, they're your people. The Nursing and Midwifery Council, who don't call women expected mothers anymore, they call them pregnant persons or birthing persons. The Nursing and Midwifery Council, who are endorsing, along with the NHS, men taking a concoction of chemicals and hormones in order to put their nipple into a baby's mouth so the baby can suck it, and then those men will get some affirmation, erotic affirmation, to be so-called mothers. So that's what your tax money's paying for right now. That's your national insurance. It's going to a group of overprivileged, mindless morons who are deciding that the healthcare in this country should be governed by people who think women have penises. And I don't know about you, but as a woman, the last time I checked, I didn't have a penis. I feel somewhat upset about that. I have a couple of penises on the shelf, and I do live with people with penises who we actually call men. So, if your wife, let's say like this young woman walking by, she wears a hijab, in the NHS she is not entitled to single-sex care, and the person that comes and gives your wife, your sister, your mother, an intimate exam might be a man who calls himself a woman. We would just call them men. In fact, I would just call them perverts, but apparently man will do. And they will come, and the NHS and all the nurses around that man will facilitate that man in actually giving your wife, girlfriend, sister, daughter an intimate exam. We call that actually enabling a crime and being accomplice to sexual assault, which is essentially what the whole of the Nursing and Midwifery Council do. Now, in addition to that, they erase the language meaning woman. They erase the language meaning woman, so you might be a menstruator, a cervix haver, a chest feeder, or a birthing person, but you won't be a woman unless you're a man, and then if you're a man, you can be a woman. If you're a woman, you can't even have a vagina these days, you might have a front hole. And so this is all endorsed by the Nursing and Midwifery Council, who, quite frankly, have lost their collective minds. And why have they done that? Well, because they're all wearing LGBT pride lanyards, the trans progress pride lanyard, which also means that they endorse the sterilising of children and not one of them stood up against it. It also means that they endorse the Chelsea and Westminster Hospital, which is a £5 million enterprise, which is about to open an entire floor of a hospital just for phalloplasties, which let me tell you what that is. They'll cut the forearm off a young girl, and what they'll do is they'll fashion it into something that's the shape of a penis and sew it back on. Now, any gentleman walking by, I don't have a penis, but I understand they're quite sensitive and complicated things, and I don't think you can make one out of a forearm. But the Nursing and Midwifery Council, they will endorse that. And in addition to that, they won't support their members. They won't support any of their members who have stood up against this ideology, So they haven't supported their members who don't want to sterilise children. They haven't supported their members who simply want to go and get undressed after a grueling 12-hour shift in a changing room without a man being in there calling himself a woman. Anyway, it's not just about me. Feels like it should be. It's not just about me. We've also got men, when they go in for an x-ray now, they will be asked if they're pregnant. Look, medicine's got a long way, but I've yet to see a man give birth. I think that would be quite painful, squeezing out of a tiny little penis. Who else would like to speak? Are you going to? I'm looking at you, Sue. Did you want to go first, Sally? Do you want to go first, Sue? No, come on. All right, I thought you might want to warm up. Do you want me to hold it, or do you? Yes.
That's okay. Thank you very much. Last year was a difficult one for the Nursing and Midwifery Council with a Dunning review by Nazir Afzal. He was a former prosecutor with the CPS. He said that there was a toxic and dysfunctional environment. And he said that one nurse wasn't struck off for 7 years after committing rape and sexual assaults against colleagues and patients.
Can you do me up?
Colleagues spiked their drinks at social events. He also sexually assaulted patients. So why did it take 7 years after the first complaint was made about him for him to be investigated and struck off